Hi everybody, it's Michelle here again with birthuhura. Here at birthuhura, I am a full spectrum plant-based holistic doula and an advocate for all things safe, natural, and effective. Here on this channel, we discuss all things pregnancy, birth, and womb health related. So if you guys like the content, you like what you hear on the channel, please be sure to subscribe. Today's topic is going to be about placenta and the afterbirth and how we rush to expel the afterbirth after giving birth to our babies. So this is something that I want to talk about because I often find and hear women talk about how they were rushed to deliver the placenta. And it's all of these things going on. They're pressing on your stomach. They're tugging at the cord. They are giving you extra Pitocin in order for you to contract so that we could get this placenta out. But the thing about it is that we don't need to rush the placenta out. It is really not necessary. Well, keep in mind, this channel is not intended to give medical advice. This is for information and educational purpose only. Please do your extra research. Please look further into this. I'm speaking from experience of my own and also of other people who I have worked with. I personally didn't deliver my placenta for my last two for at least, one of them was like 35 minutes and the other one was well over an hour. So, and we were fine. And one of them was a lotus birth. So here's the thing about this. Your placenta will detach. There are very few instances where you will have a retained placenta where you go longer than an hour without the placenta, coming down, expelling out of the womb. But it's not at all necessary 5-7 minutes after you have just birthed your child to be pressing, tugging, pulling. That can actually cause more damage. That can actually cause you to hemorrhage. That can actually cause microscopic lacerations. That can cause different issues that is unnecessary when we just can be patient and allow our children to feed, to nurse on their mother for contraction purposes. Now, I don't like to call these things contractions. Everybody knows I call them urgent, like, the urge to, push, or the urge to, the surges of, the waves. That's what I like to call them. But for the sake of this conversation, if your baby nurses soon after he or she is born, it is already it's already causing your uterus to start to contract and help your placenta come down. There's no reason why we need to push Pitocin, because that interferes with nursing and breastfeeding. That interferes with your ability to create milk. That interferes with a lot of different stuff. And it also is very much painful, which would cause the mom to need, sometimes pain medication and things like that. And we don't want to do that when we are trying to feed our children. We don't want to have medicines and medications and all of these different chemical compounds in our body. So again, your placenta can stay in your womb for 30 minutes to an hour and be fine. There's like, it's not like, oh, I birthed my baby and now this thing is going to rot and cause disease or start making maggots or anything like that. Yes, it is a raw organ. Yes, it is something that it has been in your body. It is flesh. It is all of that stuff. But let's look at this. When meat eaters eat food and they thaw it out and it's sitting on the counter, who knows how long that meat has been frozen, or how long it has been preserved in the market, or how long, whatever. The process from slaughtering to, uh, getting the skin off, to packing it up, to getting it to the store. Who knows how long that process is? And we talk about, oh, bloodborne illnesses and blah, 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 blah. Well, when you're eating beef, where you're eating meat, where you're eating any of these things that run blood, rare meat, and all of these different things, and fish, and all of that stuff, raw sushi, and all of that stuff, we don't ever talk about, oh, this is raw. This can cause bloodborne illnesses, or pathogens, or whatever the case may be. We don't rush those things away and put formaldehyde on it and any of that other stuff. This is something that is actually super fresh, because we just birthed our babies. It's not like it's been sitting there for days and hours on end. It is your placenta. It's provided everything that your child needed thus far. So it's no reason for us to be tugging and pulling and causing more damage than necessary. It's okay. It's actually okay to relax and give your body time. Be patient. Give your body time to expel this placenta. It does not need to be rushed out of your womb. It is not going to kill you. It is not going to. Now, if you have already had some kind of infection, or if you, something was already wrong, then maybe, yes, that needs some medical attention. But if you have been healthy and you're fine and your baby is thriving once the baby is on you after you have birthed them, allow that blood to, get to the baby. And, we can worry about the placenta when the placenta is ready to come down. But there's no reason to be panicking and rushing. I've seen nurses and I've seen practitioners, like, okay, come on, we got to get the placenta out. And everybody is just, frantic and pressing on mom and doing all of this and rubbing the fundus and all of that stuff. And it's really just unnecessary. It's uncomfortable, and it's causing anxiety, and it's making her feel like something is wrong, and it's not. Nothing is wrong. You are okay. It will come out. And there are herbal teas to help get this down if we were to run into something, like, okay, it's time has been prolonged, and you haven't expelled it yet. But for the most part, if you stand up, if you nurse gravity, it comes down. It comes down. It is okay. So that's my take on it. Please stop allowing people to rush you. Please stop allowing these people to tug on you, to push on you, to coerce you, to threaten you. You let them know, listen, I do not wish to do this. I am okay. I would like a minute. I'm uncomfortable. Can you come back? These are things that we have to understand, and it's not mandatory. Nothing that goes on in the hospital can be forced on you. You are an autonomous human being. Please understand your rights and practice that. Again, my name is Nichelle. I'm a full spectrum holistic doula with birthuhura. If you guys have questions or a topic that you would like me to talk about, please reach out to me at birthuhura@gmail.com. And yeah, if you have any advice or tips, or you want to talk about your story or questions, please drop them in the comments, and I will see you guys for the next video. Thank you guys so much. Peace and pregnancy deaths.